Hi everybody, I'm Phil Fatica. Welcome back to Mill Creek Government Channel 9. The gentleman sitting next to me is Mark Amendola. He is the Executive Director of Perseus House. And I'll bet you a nickel that you've all heard of Perseus House. And Mark is here to tell you not only about it, but how it got its name. Perseus House, we all know it. What do you do? What is Perseus House?
Well, the name itself came, Steve McDermott, who was the original executive director, had this idea from Greek mythology that Perseus was sent on this immortal mission to slew Medusa. Medusa was after Andromeda, so he started to name the boys' programs Perseus and the girls' programs Andromeda. Okay,
so it's got a great name that people remember. What do you do? What is Perseus House? And is it more than one house?
It is more than one house, and we really provide educational and residential services. On the residential side, we have 90 residential beds. And in those 90 residential beds, we provide mental health treatment, sex offender for young sex offenders. We provide delinquent services to young men and women who are in need of that. Most of the kids are adjudicated through the courts. So most of the kids come through the courts through either children, youth, or juvenile probation. But about 30% of the kids are voluntary. So they are voluntary mental health kids only. And their parents would say, my child is in need of this. Have a medical necessity treatment plan by a psychiatrist, and then we would take them in the door.
Okay. You have more than one location.
We do.
Can you allow the name where they're located?
Sure. Our main office is located at 1511 Peach Street, where our central office is. We have a shelter that has 16 kids that we run for Erie County. We have a mental health program that has 12 beds for males. Florence Crittenton is a division of Perseus House. So we have 14 beds also there. We have a maternity and a mother-baby program, and not too many of those programs in the state. So that program stays pretty full. Imagine on the maternity side, we're trying to get to a healthy pregnancy. And then we keep kids. We then assess for the courts, is that child really able to parent that child, and we help make that determination for the courts. We have a intensive treatment program which takes sex offenders that are not predatory type kids, but kids that have began to show some of those predictive factors. We have a program on West 6th Street that has 6 beds for males that have had significant behavioral and mental health problems, and really is a last chance before they get into the state system. We have a program in McCain, Brighter Horizons, which has 10 mental health beds for girls, and then we have 24 beds out in Spartansburg, Pennsylvania, which has a 12-bed unit for intensive treatment unit, more the delinquent kids, and then 12 beds for mental health for girls.
And all of this falls under Perseus House.
Under the umbrella of Perseus House.
And I'm sure as you're listening to Mark talk about this slang ain't no cheap date. This costs money to do this, and we've just gone through the state cutting back significantly on funding for education in some particular areas. Has this affected you, or will it affect you?
It has affected us. On the residential side, we haven't had a rate increase in some of our programs for up to 8 years. That means that we administratively have to cut. In the last 3 years, we've probably cut 35 positions. Significant amount of those positions being administratively, but we still have to provide the service that our contracts call for. We've been advocating at the state level to try to help the state understand what it is that we need to do, that they're asking us to do, and we'll continue to do that. On the school side, there's also the Perseus House Charter School of Excellence, and that is a totally separate corporation driven by a totally separate board. The state impact there is that because of the reduction in the budget, it then goes to the pure pupil cost. So we're probably going to lose about $1,200 per kid. The money follows the child. So if a child comes from the Erie School District, it follows them, Harbor Creek, whichever district. But again, though, a reduction of $1,200 per kid translates to about 10 teachers that we had to lay off this year. So the budget has had a significant impact on us on both sides of the equation.
We could discuss this for days. There's so much that Perseus House does, and so much that you are in charge of. The evidence-based practices are used, which means what?
We've been using evidence-based practices since 1994 when I walked in the door.
By the way, what did you do before you did this?
I worked at HAMD, an Institute for Behavioral Health. I ran the Adolescent Partial Hospitalization Program.
So you have a long history of working with and being involved in this kind of...
I do. I have a private practice that I see kids and families. So I have spent the majority of my professional career working with kids and families.
For those people who want to know, what kind of educational background do you need?
I have a master's in social work from Case Western Reserve. Traveled on the weekend, for 3 days straight, to be able to, 2 years straight, to be able to get what I wanted to get. And that gets me licensed now in Pennsylvania, so it helps me do the job that I can do now, but it also allows me to engage in that private practice.
So the evidence-based practices, as we were saying.
Not unlike you would think of this from if you had diabetes or a heart condition. There is very specific rigor that has been tested for practices. So if you're diabetic, we know that there is a specific oral medication rigor. You may be on insulin, diet, exercise, those kinds of things. The same thing with heart disease. There are very specific practices that you're going to engage to either reduce or totally stop wherever that comes from. So there are, if we try to understand what are the best practices that are going to work with the kids that we work with.
When you say kids, is there a cutoff point where you...
There is. We work with kids from 0 to 18 at Florence Crittenton, and we have babies. Primarily in our other residential programs, they're 13 to 18, and then the charter school is grades 7 to 12. So there is mostly pre-adolescents to adolescents mainly. But then their evidence-based means that there is rigor, that it has been tested over time to have showed very specific outcomes with the population of kids that you're working with. On the residential side, primarily, we're looking at reducing recidivism, because a lot of the kids come through the juvenile justice system, they have been charged, so we're looking at a year out, we're following those kids, and we're looking at a year out, are they not committing a crime again, or are they not engaged in the system? The Office of Juvenile Justice and Delinquency Prevention's benchmark for that is 30%. Our most recent study of 5 years of data has us at 7%. We're pretty excited about that.
Yeah.
That's good numbers.
Now, take the table here. I'd like to use the example a lot using this. What percentage of this table has the size of the table, bad analogy to begin with, the size of the table enlarged, stayed about the same, or gotten smaller with the Perseus House population that you're using? In other words, are you seeing more students into this program, about the same as you used to, or is it lessening?
The numbers are about the same. The pie has shifted.
How so?
When I started, we had about 15% of our programs were community-based, where we engaged in programs. We have a diversion program for the courts. So kids go to court, may be court-ordered to a residential facility, they get deferred, they then come to our program on the weekend, and we work intensely with the families. The benefit is it's about a third of the cost of residential care. Kids are in the community, and we're working with their families. We use one of those evidence-based practices, aggression replacement training, to work with the kids and parents together. Our student assistance contracts, which are assessments in schools, have increased. So we've gone in the last 15 years from around 15% to about now 35%. So that pie now is community-based programming is now about 35%. There's been a stop on the growth of residential care just because of the cost, quite honestly, and the push at the federal and state level to keep kids in the community, and we've responded to that.
Are you at liberty to say what the cost is? I know it's a pretty high number to do some of these programs. Some of them have a large number attached for a year.
Sure. Our residential per diems run anywhere from $190 to $525 a day. A day.
Yeah, and some of these students, children, and young adults are in this program for?
Again, depending on what program it is, it could be for 120 days to 14, 15, 16 months. I mean, it just depends on what the need is and what the disposition is. Where are they going to go when they leave the program?
The next logical question is, where does the money come from? I mean, we're talking some dollars here.
It is. I mean, the combined budgets, because we have the two different budgets are, I mean, it's a little bit over $19 million, 520 employees. there are a lot of expenses. It's a combination. On the school side, the district of residence, that money falls at child. So they determine what the cost is. They determine a regular ed student cost. They determine a special ed cost. On the residential side, it is a combination. It is a combination of state dollars, county dollars, and federal dollars. So when the federal budget gets slashed at a certain level and then gets pushed down to the states and ultimately down to the county, then that has a huge impact on everybody. So, but it is, and we also have Medicaid funding, so some of the programs are directly funded through Medicaid. So we are licensed through the Joint Commission Accreditation of Hospital Organizations, so that funding, then we then get a rate for that Medicaid funding. Fee for service is a contract that we would contract directly with the county. So in our case, we contract directly with Erie County, and then every other county that is interested in contracting with us agrees to that rate that we contract to Erie County.
When you say Erie County, you're referring to the Office of Human Services, which has a broad Office of Children and Youth, Drug and Alcohol, mental retardation, et cetera, et cetera, et cetera.
Absolutely.
There's just so much here. There's just so much here. Do other communities have a similar program that exists in Erie County as this? Does every county do this, or do they go, tough luck, kid, you know? We gave you 2 chances, you screwed up. Take your chances on the street, take your chances with the courts, take your chances in jail, or worse.
You're sure. I think that many counties in the Commonwealth, if we talk about the Commonwealth, have very similar kinds of programs. Where it differs a little bit is the judiciary. You know, how do the judges look at it? There's been a bigger push to keep kids in the community, which has to be assessed very accurately, because if it's not assessed very accurately, then you're going to have a kid that's going to end up in residential care, maybe sicker, and then make it cost more because you're going to have a kid that's longer in residential care. So there are very similar programs across the Commonwealth. I think Erie County actually does a good job in trying to provide a wealth of services for families to be able to meet their needs from a community point of view to a residential point of view, and then transition back into whatever that might be.